Concern and fear over the AIDS virus is pretty much commonplace nowadays. But what about AIDS in the workplace? Should we be more concerned about this? Hi, I'm Carol Frausto. Today we'll find out the answers to these and other questions from County of Santa Clara health educator Chris Wilder, next on Take 53.
You've taught your children to be polite and friendly, but have you taught them when not to be?
Hi there. Do you live around here?
Uh-huh.
You going to school?
Yes.
Well, I could give you a ride.
Last year, 50,000 children disappeared, many of them from nice, safe neighborhoods.
It's okay. Come on, help me.
Talk to your children about not talking to strangers, and do it today. A message for your child's safety from the American Medical Association.
You might think people with the AIDS virus look sick, but most don't. It can be years before the symptoms show up. So if you have sex, don't take any more chances than you have to. Use a condom, because you can get AIDS from someone who looks perfectly healthy. That's how I got it.
Welcome back to Take 53. No doubt within the next few years, you or someone you may know could contract AIDS, acquired immune deficiency syndrome. With no known cure, skepticism and distrust about this disease is on the uprise, and nowhere is this more apparent than in the workplace. Joining me to discuss AIDS as it affects the workplace and how you can take advantage of AIDS-related services is County of Santa Clara health educator Chris Wilder. Chris, I'd like to welcome you to Take 53.
Thank you.
You recently hosted 4 group presentations at City Hall, and I was wondering why you feel there's a need to promote AIDS awareness in the workplace.
Okay, that's a good question. Actually, I've had that question asked to me in a sort of a more antagonistic way before. I had someone in one audience say, well, if you don't get AIDS at work, why are you talking about it at work? You know, and I think there's a lot of ways to answer that that are real important. First place, if you look at who are the people that have the disease, if you look at it just by age group, it's mostly people in working age groups. You know, it's a disease that primarily affects adults. And so, as an access point to people that may be at risk to the disease, the workplace is really good. I think there's another reason, too, that's really important. Today, or at least say statistics by the end of 1988, there were about 81,000 diagnosed cases of AIDS since they've been recording that in the United States. It's anticipated by the end of 1992 that there may be 365,000 cases. So there's going to be people at work that people are going to be in contact with that have this disease. And people need to know that. They need to know how to react to these people, how to react to workplace settings where they may be working with someone who is either infected with the virus or who has the disease. So it's going to be something that's going to affect more and more people, either directly or indirectly in the workplace.
Do you feel there's much of a risk working alongside someone that does have AIDS?
Yeah, actually there's no evidence that there's any risk at all. And that's really not even new information. The Center for Disease Control, which is the main information branch of the U.S. Public Health Services, in 1985 actually published information that basically said, you know, working with someone at AIDS, sharing a drinking faucet, being next to them, sharing tools, didn't really pose any risk at all. There's no evidence that it does.
Do you think that AIDS or carrying the HIV virus, can you explain to me how it differs from other life-threatening illnesses, carrying the HIV virus?
Yeah, that's a good question too. There's a lot of things that are similar. If an employee has cancer, an employee has a heart disease, all of these are life-threatening illnesses, and people are faced with the same difficulties relating to someone with a disease like that. How do you react to someone who may have a disease that they can die from? How do you show sympathy? How do you not get more involved than you want to be? These are all issues that everyone has to face in the workplace. And it's real difficult if you have a coworker or a friend who is in that situation. But AIDS is also something special. something different. The first difference is really the fact of fear of contagion, or that the disease is infectious. Georgia Tech actually recently did a survey study of people's attitudes towards AIDS in the workplace. And some of the results were really startling. 65% or so of the people surveyed would be uncomfortable sharing a bathroom with a coworker who had AIDS. About 40% would be uncomfortable eating in the same cafeteria. So you've got that element of fear, which makes it different. The second element that's different is the people that are affected with the disease. Oftentimes the stigmatized groups in our society, gay males, IV drug users, this kind of attribute of the people who are affected with the disease oftentimes cause reactions to the disease itself, which doesn't have much to do with the disease, but has a lot to do with their attitude towards these particular groups. So I think in that way the disease is a lot different. Although it is a life-threatening disease, it has these attributes that are different.
Do you think that that's why nowadays we see so many people afraid of this disease, because there's not enough education, and also that maybe we're looking at these groups in more of a negative light than someone that has cancer?
Well, definitely the stigma is a factor on how people look at people who are affected with the disease. And the fear is certainly an element that comes up all the time. Actually, the health department started trying to do AIDS education in the workplace way back in the fall of '84. And we started writing letters to various companies offering to come out and provide educational services. Nobody was interested. You know, nobody was really interested. And after a year or so, we started to get more response. More companies were interested. Usually, it was because something had happened, some crisis had occurred. One example of in a bank, a loan officer was on vacation, and the rumor got around, whether it was true or not, that he had AIDS. And what happened? I mean, people were not coming to work. He had files that needed to be processed, that no one would touch his files and work on his files and things like that. And so businesses started to see, well, you know, normal work functions aren't being carried out simply because of this fear. And a lot of that's still present. You know, it wasn't more than a couple months ago that we got a call from a small business where one of the employees had to leave early that day because a relative had been diagnosed with AIDS and she was going to the hospital to see him. And boy, when she left, one of the people grabbed a can of disinfectant spray and started spraying her phone. Other people didn't know if she should be allowed to come back to work. Other people reacted because these other people's reactions seemed too much, you know. So the end result was the work process was really disrupted. So the problem isn't going away. The same fears, same stigmatization still goes on.
That's very interesting. I'd like to stop, take a little break right here, and when we come back, have you explain how your presentations work and why they've been so successful. Please stay tuned.
Every drunk driver who killed somebody thought he could handle his liquor. But liquor affects coordination, reflexes, and judgment, and you're no exception. I know you heard all the arguments before about risking arrest, imprisonment, loss of your license. But there's just one thing I want to get across to you. Everyone who drinks and drives risks taking a life. For more about drinking and driving, write the Will Rogers Institute, White Plains, New York.
My brother wouldn't listen to me. I told him, you have sex, you use condoms so you don't get AIDS. He laughed and said condoms were macho. My brother, he was so macho.
Welcome back to Take 53. I'm Carol Frausto, here with County Health Educator Chris Wilder. Chris is going to tell us about his presentations to various working adults. But before we get into that, I wanted to talk to you about policies that companies and like the city of Cupertino are adopting regarding life-threatening illnesses. What do you think of these policies?
Yeah, actually, when I saw the policy that the city of Cupertino did come up with, it's really excellent. And I think companies and businesses that adopt policies such as this are really going in the right direction. The history of it's a little bit that as AIDS has become an issue, many companies are starting to adopt policies either specifically designed to AIDS issues or incorporating, like the city of Cupertino did, AIDS as another one of the life-threatening illnesses that might affect employees. I think the thing it really does, which is really helpful, is first of all, it lets people in the company, in the business, know what the policy, the attitude of management is towards this disease and other life-threatening illnesses. So people have a clear understanding of that. If crises do arise, which it often does with AIDS, it gives management an idea of how to proceed. You know, they're not just dealing with a crisis without a basis of how to operate. It gives employees information about the disease. And another thing that was really beneficial that the city of Cupertino did was incorporate education along with introducing the policy. So it really works well to inform and educate employees. And also, I think, and this is a real important point, is those people then that may have AIDS, that are afraid of discrimination, that are afraid of the reactions that they might get if that condition was known in the workplace, have some assurances. You know, they know that they won't be discriminated against, that they won't lose their job, that issues like this can be brought out with their supervisor, with management, and so they are in a position to take advantage of some of the benefits that they may not receive because they're afraid to tell anyone what's going on. So from the infected employee, I think it's really important as well.
Getting back to talking about your presentation, and we mentioned that earlier that we did have a presentation, several presentations here at City Hall. Could you outline for our audience what the presentation entails and some of the strategies and goals that you incorporate into that? Okay,
I guess if you talked in terms of a goal or strategy, what's paramount for me is involvement. Involvement of the people who are in the audience. I think for a lot of people, AIDS is always somebody else's disease. It's something I don't have to think about, I don't want to think about. What I try to do in the presentation is not to shock people, not to scare people, but to at least understand that AIDS needs to be something, the disease, what's happening in this country needs to be incorporated in some way in their life. And so that's what I shoot for. And that's why a lot of the educational things, tools, strategies that I use help do that. Try to involve people in the whole process of the education.
I know this is tends to be a touchy subject. How do you get people to open up about their feelings in these presentations?
Well, it's not so much opening up about their feeling, it's recognizing what their feelings are. Yeah, you don't really want to put people on the spot. I'll give you an example. Again, one of the exercises that I did with a lot of the groups that I was training here at the city of Cupertino was I had them do what's called a forced choice exercise. And what I would do is I'd have everyone stand up, they're getting involved, they're not sitting there just listening to a lecture. I had them stand up and I would ask them a question. I would ask them a question like, would you be uncomfortable going to the hospital to visit someone if you knew they had AIDS? And what I do is I tell them to stand on one side of the room if they agree, another side if they disagree, or maybe if they're unsure, they may stand somewhere in between. And it's not a right or wrong kind of an answer. They're just supposed to use their gut level reaction as how they would place themselves. And after that, some people start to talk about, well, why they put themselves here, why they put themselves here. And a lot of people don't say anything, and that's not important. It's just that they become aware of what they feel about certain aspects of this disease.
It's interesting. What other types of visual tools do you use to enhance your presentation?
Yeah. Well, again, the use of tools, audio-visual stuff, again, all relates to will it work to get people involved. I use some of the standard stuff. I use overheads, I use slides sometimes, but it's not always that necessary. And one of the groups that I was working with here at Cupertino, I mean, I had this presentation outlined, had this long outline, I had all these overheads, I had these exercises to do, and I got maybe through my first overhead and my introductory remarks, the whole rest of the presentation was questions. The audience was involved, so I didn't need to use any of that stuff. The same information basically got across, but it really varies on the audience and how it just happens to work with each audience in terms of involvement.
Are you ever surprised or maybe not surprised by the amount of knowledge that you find in these groups regarding the AIDS disease?
I've talked to high school students, and sometimes it's really amazing the kinds of questions they ask me, and very detailed stuff. Some of them I have difficulty answering, as detailed medical kinds of questions. A lot of people know a lot of things. And I guess it's not really surprising in that AIDS is not a new disease in terms of information. I mean, there's all of the TV, all of the newspaper, all of the other media coverages. People are going to know a lot. Again, knowing something certainly isn't the same thing as changing either attitudes, feelings, or behavior. So again, if my only job was to give information, I'm becoming more and more superfluous for a lot of groups. But I don't think that's all that education is.
Do you ever find it hard to separate your personal beliefs and your educational by putting out the facts? Do you ever find that difficult?
Yeah, I think there's never any kind of value-free health educator or education. You always have your own personal beliefs and attitudes that are a part of you. And if you didn't have that, I mean, that's a lot of what inspires you to do the job that you're doing. I mean, you really want to make a change. I think what's important is to recognize that, to be able to separate out what's good public health education, which certainly can incorporate some of your own feelings, and what might be something that might be characterized as moralizing or preaching. Things like that you certainly don't want to do. That's not education. So again, but you always have to check yourself. You know, periodically you have to say, well, why did I talk about this and not that? And you really have to look at that.
We haven't touched on the types of people that contract this disease a lot, because I wanted to get into the education part of this. But do you think that people with the belief that gays and drug users are the only people that are contracting this disease, do you think that you're able to change their biases through the educational process?
It certainly has happened, you know, and so that's really encouraging. Again, here's a disease that people would rather not have to deal with. So it's much easier to label it as somebody else's disease. It's a gay disease, it's an IV drug user disease, rather than have to deal with them personally may be at risk through some of their behaviors. They personally have to look at what they do in their lives. So there's always that tendency still to not incorporate the facts of how you might be at risk into your own life. So it's a constant battle, but it's not a losing battle.
I'd like to pause there, take a break, and when we come back on Take 53, we'll get into how the county is involved in AIDS programs, the people and agencies that you can contact for information and get your questions answered, next on Take 53.
Hi-ho, this is Kermit the Frog, and this is one of my very favorite places, a forest. You know, forests are home to lots of animals, and they give us wood, and they keep our water and air clean. Unfortunately, these days our forests are in trouble. They're being threatened by development and people who don't treat them with respect. To find out what you can do to help, write to Forests, National Wildlife Federation, Washington, D.C. 20036. Remember, forests are more than trees.
This baby started life with little chance of living it. He was born with the AIDS virus. At some time in the past, one or both of his parents just weren't careful, didn't use condoms, and caught the virus, then passed it on to him. If you don't use condoms because you're not worried about getting AIDS, try worrying about who you can give it to.
And we're back on Take 53 with County Health Department AIDS Education Specialist Chris Wilder. Chris, do you conduct any other types of presentations besides the AIDS in the workplace?
Yeah, really, the County Health Department through the AIDS program really does a lot of different groups. We go places like jails, PTA, chemical dependency, treatment programs, juvenile detention facilities, all kinds of a real variety of different groups. We even have, part of our program has staff that go actually in the street. They do a street outreach program aimed at IV drug users and the homeless. So it's a real broad spectrum educational, community educational program.
How many other AIDS educators work for the county, and do they do the same type of work that you do?
Well, again, that's a real, in terms of the number of people, it's really hard to say. We have in our own office, we have 4 full-time people that are doing community health education. But we're not the only ones that are doing that, even within the county system. Public health nursing, which is again part of the health department, has a group of nurses called, they're called alpha nurses. And they do specialty work with AIDS issues. They do a lot of surveillance kind of issues. They do visiting to homes of people and families that have AIDS, collect a lot of data and provide information and resources. Plus they do community education. We offer clinical services where when people come in for services, for testing for the virus or for other kinds of AIDS-related services, they see staff there that provide counseling and education. So it's really a broad spectrum kind of approach, and there's not just one group of people that's doing it.
What is the general purpose of the Santa Clara Health Department's AIDS program?
Again, it's really multifaceted. We've talked mostly about the community education that I'm involved in, but we also offer clinical services. We have, for example, it's called an alternative test site, and that's, we're not unique in that, but what it is people can come in to our clinic and get tested for the AIDS virus, and it's done anonymously and it's done free. So that's one of the services. We also offer medical follow-up to anyone who's tested positive. So that's another clinical service that's offered. Mentioned before the surveillance aspect of the disease. One of the ways we know about this disease, that we've learned about how it's been transmitted, is people have just gathered data. And the public health nursing, that's one of the things that they've done, is that they interview people who have been diagnosed with AIDS and get a lot of this data. How were they infected? What kind of behaviors did they engage in? So that's another aspect of the disease. We mentioned the other things that public health nurses do, and there's one other real important organization that's really not a part of the health department, but it's coordinated by the health department, and that's this organization called ASPN, which is AIDS Service Provider Network. And basically that's what it is. It links up not just health department, government kinds of programs that deal with AIDS, but all of the other kinds of voluntary organizations and other services providing social adjustment services, counseling, things like that are all sort of organized in a network situation so that they can know what everyone's doing, what's going on.
Do you think you could tell me a little bit more about the surveillance team? I didn't really understand what you meant by that.
Oh, okay. AIDS itself is a reportable disease, meaning that although names are confidential, certain data about a patient who's been diagnosed with AIDS is sent to a central collection agency. In this case, it's the Center for Disease Control, part of the federal government health department services. Okay. What our surveillance team does is do the local collection of that data. So when a person is diagnosed with AIDS, and we get that information from hospitals or from private physicians, we're contacted, and one of our public health nurses in the health department will go out and talk to these people. Not only provide information and link them up with services, but we'll collect the data, which is then tabulated and forwarded on. So that, again, we're part of the whole process that gets this kind of information that's used throughout the country for making decisions. There's another part of surveillance, too, in that we collect testing sort of study results. For example, we've done testing of the what's called seroprevalence studies. In other words, the number of people who test positive to the virus and the antibodies to the virus. So we'll go out in places like jails and do surveys. We'll offer the services of testing to the inmates, but also use that. It's confidential, it's anonymous, it's not, names aren't reported, but it's statistically it's real important to what percentage of people of that group might be infected. We've been college campuses doing the same sort of thing.
Another thing that you mentioned that sounded interesting to me was the street outreach. That sounds like an extraordinary service that the county offers.
It's one of the really unique services that we do offer. That's been in operation for just a little over a year. And it's real interesting population to reach. What we have is community outreach workers that are familiar. They've had experience living on the streets maybe themselves, or at least familiar with the population. And they basically go out there and provide education to people on the streets, maybe IV drug users, maybe homeless. They provide such things as condoms, materials, information pamphlets. And, you know, initially it was tough. You know, people didn't trust them. You know, it's hard to build that rapport. And now the rapport has grown in the areas where they're in, it's Central and East San Jose where they're most active, that people actually call them, ask them questions, ask for some materials, things like that. So it really is an interesting service.
It does. It sounds great. Where does the county receive its funding for these types of programs and projects?
Well, that again is really diverse. We get county funds, state funds, federal funds, and we also get private donations. So it's a real hodgepodge of different kind of funding services.
Chris, I'd like you to tell me where people can contact you to find out about AIDS in the workplace programs or other AIDS-related services that the County Health Department offers.
Yeah, we do have a central number where we can give that information out, and the number is it's area code 408-299-4151.
And if someone calls in there, what is the process that it takes for someone, for example, the city, they just call in and ask for an AIDS educator to come out to the workplace?
Yeah, basically that's it. We do have an education coordinator who handles the initial screening of the calls. And that person then will assign one of the health educators to provide or to contact the agency requesting the services and work out any kinds of details as to specifically what kind of program they need, and then to arrange times and places.
Is there any type of a waiting list for this?
We meet all our requests within a month. So again, it's not, sometimes it can be instantaneous, but most often there is some delay, but not more than a month. Another one of our really unique services that I'd like to mention is our AIDS prevention and follow-up service. We have one of the two health programs in the state that has this model clinic. And basically what services it provides are for people that actually test positive for antibodies to the virus. And they're able then to get special services, including medical services, doing a whole battery of lab tests, for example, consultation, counseling, linkages to all kinds of different services that they may need. We even have a nutritionist who is a consultant to all of these patients who actually meets with them and talks to them about diets. And at this point, our clinic is a model clinic for a number of others that are going to be starting up in the state of California.
I'd like to thank you for joining me today.
Yes, okay, thank you very much. It was a pleasure being here.
Great. I'd like to thank my guest today, Chris Wilder, Santa Clara County Health Educator, and I'd like to thank you for joining me, Carol Frausto, here on Take 53.